Hi guys, my name is Rachel. I'm a dental hygienist here at Olean Dental Studio, and we are located in Port Charlotte, Florida. Today we're going to be talking about some dental hygiene topics. So what is proper dental hygiene? Proper dental hygiene begins with a good established home care routine that includes brushing, flossing, water flossing, tongue cleaning, and using an alcohol-free mouthwash. And that is something that we should be doing every morning, every night, and continuing to do so every single day. I personally recommend the electric toothbrush to my patients. It has been proven to be more efficient at removing bacteria, as well as using the water pick, as well as regular straight floss on a daily basis. But you can do the water pick every day and water pick and floss with traditional floss every 2 to 3 times a week to better access areas where you're not sure the water pick is reaching. So manually with the floss, you can feel it underneath the gums. There are many risks associated with not carrying a good dental hygiene routine, such as being more likely to develop gum disease, which is linked to many other health concerns such as diabetes, high blood pressure, heart disease, and the list goes on. Also makes you more prone to cavities, makes you more prone to need a root canal, and just overall be in pain. Let's talk about the duties of a dental hygienist. For me personally, always number one is going to be patient care. So always making sure that the patient feels heard, that their questions are always being answered, that I'm gentle enough to provide the least amount of uncomfortability, pain, all of the things. And always equally as important, supporting our doctors, making sure that I'm always available, help in any way that I can, because at the end of the day, the overall goal of our office is to provide excellent patient care. One of the questions we received is what's included in a dental cleaning? And to be honest, there's a lot involved in a dental cleaning. But as a general rule, we are removing bacteria, which is plaque, from under the gums, making sure everything's clear, and that most importantly, we educate the patient on how to keep everything clean, free of bacteria at home, by areas where you may be missing, where to brush a little bit more, where you're missing when you're flossing, how to reach a back tooth that's harder to reach. So there's many different steps in a dental cleaning, but most importantly is making sure that the patient is comfortable, that they're not in pain, and that they leave happy from their dental cleaning. Now let's talk about what instruments a dental hygienist uses for a cleaning. There's many. They're all going to be in this little pack here. And the ones that we mainly use depends on the type of cleaning, how long it's going to take, really just depends on the patient and what we're doing that day. But generally includes a mirror, a probe, an explorer, a sickle scaler, curettes. And this little guy looks a little bit differently because this one is what most patients know as our water jet. It's an instrument that cleans the plaque with water and vibration, so it makes your cleaning go a lot quicker and more efficient as well. And yes, I know you can find these or similar to these on Amazon. Social media will advertise them, but no, you should never get these and use them on yourself because you can cause actually more harm than anything around your gums, which is a very sensitive area in the mouth. So let's talk about dental cleanings. Does it hurt? No, it does not have to hurt. As long as you communicate with us, there's many things we can use to aid in the process of a cleaning. There's numbing gels that we can use, there's liquid anesthetic that we can put along the gums, and of course local anesthetic to completely numb the area so that you're comfortable. Because at the end of the day, to do a proper, efficient cleaning, the patient has to be comfortable, have a good experience, and want to come back and continue a good routine. How long does a dental cleaning take? Well, it could be anywhere from 30 minutes, 40 minutes if it's a healthy cleaning. Sometimes if it's a deeper cleaning, so it could be anywhere from an hour and a half, 2 hours, really just depends on how aggressive the condition is. And if we're needing to do a deep cleaning to better access that bacteria that the patient has no access to, and that's why there's infection present now. A dental hygienist does the cleanings opposed to a doctor because we are specifically trained to treat the soft tissues, to treat the gums, and deal with the foundation of your mouth, which is your gums. And then the doctor gets to take care of the house on top of that foundation, meaning your teeth, treating any cavities, any crowns, any cosmetic work, but essentially the foundation of all of that beautiful work is your gums. So the doctors trust their hygienist to focus on my gums and take care of them and treat them and educate our patients on it. Thanks for watching, guys. I hope you liked it. If you can give us a thumbs up, comment, any questions that you'd like to ask or know more about, subscribe to our channel, and we'll see you next time.
Ya, estamos terminando.
You've had your dental cleaning and you really want to enjoy the results of a beautifully clean, fresh, sparkling mouth. Sparkling mouth. That's all I can decir.